A new study from the World Health Organization recently revealed that the earlier teens start drinking, the more likely they are to suffer from substance abuse problems or alcoholism later in life. Joining us from Los Angeles is addiction psychologist Dr. Adi Jaffe. Dr. Jaffe, thanks so much for joining us.
Thanks for having me.
So let's start talking a little bit about this study, if you would. It looked at teens not just in the U.S., but all around the world. Is that right?
Yeah, the study actually started out looking at 1,200 overall studies on teen drinking, and then they isolated that down to 50 studies that they consider as sort of being of higher quality, giving them a better indication of causality or what teen drinking causes later on in life.
And what did the study find?
So the two main findings from the study were that heavy teen drinking, so not just starting to drink as a teen, but heavy drinking during the teenage years increases mortality or death risk later on in life. And they were following people up in some of those studies till the age of 30, 35. And along with that, some increase in alcohol dependence later on in life, but mostly heavy drinking during teen years was really associated with heavy drinking later on in life, and we know that there are a lot of consequences to that.
Sure. And how did they define heavy drinking among teens?
And that's a really, really good question. So heavy drinking among teens here was defined as somewhere between 18 and 21 drinks a week. It depends on, they measured alcohol in grams. But like you just said, like you just kind of noted with that sound, you know, it's 17 to 21 drinks in teens is heavy drinking. We're not talking about kids who are just experimenting with alcohol or try drinking at a party. We're talking about kids who drink regularly and a lot when they drink. And
what causes teens to start drinking this much at such a young age?
So, you know, the question of what causes teens to start drinking heavily at a young age is a difficult one to answer. But what we can say is that, you know, a lot of teens engage in drinking. When we look at numbers, actually the numbers are down since the 1990s. You know, during the 1990s, more than 50% of 12th graders said that they had been drunk at some point in their life, and now we're looking at those numbers being lowered down at 40. We had 70% of 8th graders saying that they tried alcohol in their lifetime during the 1990s, and now we're looking at those numbers being down around 35%. But the thing is that, you know, kids learn about behavior from their environment, right? So they learn from their parents and they learn from other teens. Home environments that have heavy drinking in them or things of that nature are more likely to produce kids that drink heavily, and associating with peers that drink heavily or are deviant in some other ways can get kids engaged in this kind of behavior.
And did the study look into where the teens were getting this alcohol from, the teens that were engaging in the heavy drinking?
This study specifically didn't look at where kids got the alcohol, but the American Medical Association did a survey a little while back, and they found that the vast majority of kids actually get their alcohol from their parents. 2/3 of those said that the parents didn't know about it, whereas 1/3 said that parents did know about it. Other than the kids that get it from parents, you know, kids get it from other friends who they got it from their parents. They get other adult friends or strangers to buy them alcohol, and then there's always the issue of IDs and fake IDs that kids can use. But the vast majority of kids seem to actually get it from their parents' liquor cabinet.
So unlocked liquor cabinets, the culprit of so much teen drinking. Now, do many of these teens actually get hooked on drinking, or is this a phase for most teens?
That's a really, really good question. I would say that thinking that many, many teens get hooked on drinking is probably a little bit of a misperception. If you look at the fact that almost 50% of kids say that they've been drunk by the time they get to 12th grade, but then when you look at the overall population, we only have 10% of individuals who ever meet criteria in their lifetime for alcohol dependence. That means that the vast majority of people, right, those other 40% of kids who had tried alcohol and had gotten drunk at some point during high school, never actually meet criteria for alcoholism. So I wouldn't say that a lot of kids get hooked. What I would say is there's a subset of kids that get hooked, and I think what we need to focus on is what are the predictors that lead us from kids who try drinking to getting hooked on drinking or becoming alcoholic later on in life. And we have some indication of the sort of indicators that have that. We'd already mentioned engaging in peer groups that drink very heavily. That leads to more heavy drinking during teens and possibly heavier drinking later on in life. But also one of the things that I think parents really need to look at are risk factors that come up before kids turn adolescent or before they hit puberty. You know, if you look as early as 7, 9 years of age, there are indicators like high impulsivity, engaging in a lot of violence, school trouble, maybe some neurocognitive deficits, and definitely family and genetic history of alcohol and drug abuse. Those are the kinds of things that parents need to take into account right along with drinking during teen years to really figure out the risk factor for their kids.
Because there can be a genetic predisposition for addiction, isn't that right?
Yeah, I wouldn't say there could be a genetic, I would say there is a genetic predisposition to alcoholism and drug abuse. The estimates range anywhere between 30, 40%, up to 60% for smoking, for instance. But it would be tough to find a drug abuse problem or alcohol or maybe even any addiction problem that doesn't have some genetic component to it.
So the first step is, if you know that this runs in your family, make sure you keep an eagle eye on your kids. What are some of the symptoms that parents should look out for that can indicate their children might be beginning to have a problem with either alcoholism or any other substance abuse?
So alcohol dependence, or alcoholism as it's known in the public, is defined by a very specific set of criteria. Things like tolerance and withdrawal are the physical symptoms. Drinking more to get the same effect as tolerance. Withdrawal is the idea that when you stop drinking, your body has negative side effects. Headaches, nausea, tremors, a lot of things of that nature. And then there are behavioral effects, like drinking more than you mean to in a sitting and not being able to stop yourself, or trying repeatedly to stop and not being able to do it. Drinking heavily, continuously in the face of negative consequences, and giving up important social work and important other activities in your life due to drinking. Those would be signs that we would use in adult populations to indicate alcohol dependence. With kids, the issue is a little more difficult, right? Because maybe some of those responsibilities are not as clear, and also we don't have that long history to be able to look at like we do with adults. So I would say that one of the main things you want to look at probably is if they continue heavily drinking, and we already defined what heavily drinking is, if they continue heavily drinking in the face of negative consequences, or if they indicate that they've tried to stop before and they're just not able to, I think that would be an early sign of trouble.
And you need to step in and get your children help. All right, Dr. Jaffe, thank you so much for this eye-opening conversation, a very serious matter. And don't forget, you can follow ABC News Now on Facebook and Twitter. Just search ABC News Now.